This is a presentation on the findings of the GOC's Public Perception Survey 2023 and the Registrant Survey 2023. The aim of the presentation is to draw out some of the key findings, the implications of the findings, and what actions the GOC is taking in response. We've carried out the Public Perception Survey since 2015. For the last 3 waves of the survey, we have commissioned MEL Research to carry out the survey for us. The survey is an online survey of around 2,000 people across the UK, and the aim of the survey is to track patient and public views and perceptions of optical services and patient experiences of using optical services. For the Registrant Survey, the first standalone survey was carried out in 2016. Since then, we've commissioned Inventure Research to carry out 3 waves of the survey over the past 3 years. This year, we got just under 4,000 responses from individual registrants, with the survey being sent to fully qualified optometrists and dispensing opticians and optical students. The aim of the survey is to track registrant experiences of working in clinical practice and views and perceptions on the GOC. In terms of key findings between the 2 surveys, public confidence and satisfaction levels remain high and complaints among patients remain low. However, registrants continue to report challenging working conditions, including bullying, harassment, abuse and discrimination at work over the last 12 months. Opticians and optometrists are now the first port of call for patients who woke up with an emergency eye problem ahead of GPs, but there are differences across the nations. This could be due to different models and funding for eye care. We'll now look at the findings of the Public Perception Survey 2023. We'll focus on patient satisfaction levels with optical services, patient complaints, the differences between different patient groups, and patient trust and confidence levels within the optical professions. We continue to track how many people went for a sight test or eye examination within the last 2 years. The data shows that 77% of survey respondents had had a sight test or eye examination in the last 2 years, and this has remained fairly consistent since 2015. Only 3% reported never having had their sight tested, and this is much lower than the 11% when the survey was first launched in 2015. In terms of patient satisfaction levels, 94% were satisfied with the optometrist who carried out their sight test or eye examination, the same percentage as last year. 93% were satisfied with their overall visit to the optician or optometrist practice, down just 1% from last year, and 8% of those who had been for a sight test or eye examination had complained. While overall satisfaction levels remain high, there are differences between different patient groups. Some of the data this year pulled out differences, for example, between those with a disability and those without a disability, with those with a disability reporting lower satisfaction levels and being more likely to say that something went wrong during their visit to an optician or an optometrist practice. Looking at those from an ethnic minority background, they were more likely than white respondents to feel uncomfortable about visiting an optician and optometrist practice and cited cost as one factor. They were also more likely than white respondents to have considered complaining about an experience. In terms of receiving a high standard of care, 92% of respondents were confident in receiving a high standard of care from their opticians and optometrist practice. When we compare this with other sectors, we can see it's higher. For example, 86% said that they were confident of receiving a high standard of care from pharmacies, 81% from dental practices and surgeries, and 77% from GP practices or surgeries. We continue to track where people would go if they woke up with an eye problem. This year in the survey, 36%, which was the highest score, said that they would visit an optician's or an optometrist practice first if they woke up with an eye problem. And this is quite a significant increase from 2015, where the percentage figure was just 19%. The next place respondents said they would go was a GP practice, and 33% of respondents said they would go there. This is quite a significant decrease from 2015, where the percentage was 54%. In this year's survey, respondents in Northern Ireland and Scotland were significantly more likely than those in the overall sample to go to an optician's or an optometrist's practice first, while those in England were significantly less likely to go. In Wales, there was no significant difference. We will now look at the key findings from the registrant survey. This will focus on the profile of survey respondents, overall job satisfaction levels, challenges faced by registrants in daily clinical practice, new findings on bullying, harassment, abuse and discrimination at work, and registrant views on the GOC's continuing professional development scheme. In terms of the respondent profile, 80% of respondents said that they were from England, 9% from Scotland, 6% from Wales and 4% from Northern Ireland. And this more or less matches up to the profile on our register. 53% said they worked full-time and 47% said they worked part-time. Again, a fairly even split with last year's results, although slightly more saying that they worked full-time this year. In terms of locum working, 24% in England, this was the highest. Scotland had 10%, Wales 16% and Northern Ireland 15%. In terms of delivering enhanced care, 77% of respondents in Wales said that they delivered enhanced care, 74% in Northern Ireland. In England it was just 46% and in Scotland it was 38%. Looking at job satisfaction levels, these have remained fairly consistent at 62% overall. In terms of why registrants find their job satisfying, some of the top reasons were rewarding and interesting work, a good working environment, a good work-life balance, feeling valued, supported by their employer, a manageable workload and a good salary. Around 21% were dissatisfied, however, with their role or their job. And the top reasons for this were not feeling valued, heavy workloads and pressure, poor pay, poor work-life balance and poor working conditions. We continued to ask about registrants' working experience over the last 12 months. 52% reported working beyond their hours. This is a small drop from 57% last year. 37% reported feeling unable to cope with their workload. Again, a slight drop from 41% in last year's survey. 27% reported finding it difficult to provide patients with a sufficient standard of care they needed. This was 31% in 2022. And 8% reported taking a leave of absence due to stress, and it was 9% in last year's survey. This year we asked some new questions on bullying, harassment and abuse at work. In the last 12 months, 41% of registrants said they experienced this from patients and service users, 18% from managers and 16% from colleagues. We asked this question in the same way as the NHS staff survey, although we can't compare exactly like for like, as the NHS staff survey also involves staff not in clinical positions. We can see a worrying amount of registrants who reported this. More likely to experience this were females, younger respondents, those with a disability and those from an ethnic minority background. And overall, only around a quarter of respondents said that they actually reported this type of abuse. We also asked a new question about discrimination at work over the last 12 months. Just under a quarter of registrants said they experienced this from patients and service users, 11% from managers, 8% from colleagues. And this type of discrimination was based on 44% said race, 32% said age and sex, and 20% said religion or belief. This year we asked registrants some new questions around their experiences of the GOC's continuing professional development scheme. Overall, 75% of respondents said that CPD improves their practice and 20% thought that it didn't. Optometrists were more likely to agree that CPD improves their practice than dispensing opticians. And the main reasons registrants thought that it improved their practice was that it helped to refresh their knowledge, skills and behaviour. In terms of looking at some of the challenges around registrant experiences of CPD, 39% of respondents said they were not confident about completing their personal development plan at the beginning of the CPD cycle. 21% said they were not confident about participating in a peer review activity, and this was higher among dispensing opticians and optometrists. 51% were not confident in completing a reflective exercise with a peer at the end of the CPD cycle. Only 34% of registrants reported having completed some self-directed CPD, which is a new option in this cycle. But 53% said they did not feel confident in completing any. In terms of actions we are taking in response to both surveys, we have organised a stakeholder meeting in October to review the findings on bullying, harassment, abuse and discrimination at work. We have invited a number of senior stakeholders to the meeting where we can discuss sector-wide actions in response. We have also used the findings for both surveys to inform the review of our standards of practice and understand if we need to strengthen any standards, for example, our standards on discrimination at work. We will also be carrying out further research with vulnerable patients as part of the standards review. For CPD, we have enhanced our communication with registrants to help aid understanding of the requirements within the scheme. We have done this via blogs and articles. We're also creating simpler templates for registrants to use to help them complete their CPD. In terms of next steps, both surveys have been published on the GOC website. We will be retendering for both surveys in the autumn, and we will continue to track key data and disseminate this to stakeholders, both internal and external, with the next reports due in 2024.